Hello, we are going to look today at the assessment form. So this is going to help you with Chapter 7 and Chapter 9. It's also going to help you with your upcoming assignments. You have several assignments that are dealing with the assessment of an individual's nutrition status, as well as your project, which is an assessment. So in that project, you have a sample case, which I'll go over with you in another video. But I just want to take this time to go through section by section what we're looking at when we do this assessment or the screen, okay? So here's our objective data at the top, and this is an attachment that you'll find in Blackboard under this week's information. We'll put the patient's initials, their age, their sex, and then if you have this information, which unit they're in and the room number, what diet they're on, and if you have the information, what date that was ordered. You may not have all of this information. So an important piece to look at if you do not have the information is that you should be putting N/A or not applicable or not available, just so that I know you've addressed that portion. Admit diagnosis. So what are they here for? Did they have a fractured rib? Are they newly diagnosed diabetes? Do they have nausea, vomiting? So the reason that brought them into your facility. And then this is past medical history, and this is everything that has happened to them or diagnoses that they've received in the past. So this might be things like hypertension, osteoarthritis, um, type 2 diabetes, end-stage renal disease, any of those diagnoses that you'll see listed in the medical chart. Social history, are they married, divorced, college student, occupation, retired, mail carrier, etc. And then we have height, weight, blood pressure, and temperature. Okay. In yesterday's lecture, I started going over the medication, and then for your assignment this week, you also have a medication food-drug interaction worksheet. Specifically, we're going to look at those medications that were highlighted on the PowerPoint and highlighted in your book. So things like prednisone, furosemide, simvastatin, and MAO inhibitors, and Coumadin and warfarin will be the primary medications that we'll see here. So you will write down, let's say, simvastatin. The action for that is cholesterol lowering. And then what these stand for is anorexia, nausea, vomiting, diarrhea, constipation, or flatulence. Okay, you might not have that information for all the medications, and that's okay. We'll use this more when we get into our clinical settings. And then food, medication, interactions, and diet instructions. Okay, so the example I had was simvastatin, um, anti-hyperlipidemic, and then the food medication interactions and diet instructions would be to avoid grapefruit, okay, like we saw on that slide. So I'm going to end this video here so that we can have this directions in these chunks. And I'll come back in our next video and I'll talk about lab data and some of the math.